Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, those who are watching on the CTV London website. Well, let's get to the opening statements right away, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. You've heard for months, wear a mask, avoid large crowds, wash your hands. I want to add two more reminders today. Buy a poppy and wear a poppy. Earlier today on the steps of City Hall, I had the solemn honor of receiving the first poppy for the City of London to officially launch the Legion's 2020 Poppy campaign. Last year, Londoners raised an astonishing $220,000 to help support our local veterans. This year, I'm looking forward to us beating that total. Wearing my poppy today and reflecting on the sacrifices of all men and women who've served our country, I'm struck by how timely and relevant their example remains during our present circumstances. The selflessness, the willingness to make personal sacrifices for the greater good. I also think about the determination and resilience exemplified by those brave women and men. Because of their efforts, few, if any of us, are forced to endure what they endured. We can, however, uphold their values and honor their examples, especially now. We must always, above all else, remember, that's what the poppy signifies, and that's what your donation and purchasing one ensures. So again, please, buy a poppy, wear a poppy, and remember, it's that simple. On another topic, Dr. Mackie will have more on this in a moment, I know, but we've all seen the 16 new cases posted for London Middlesex today. Yesterday we had one, the day before 2. I think it's critically important now that we're in the midst of a second wave, and especially with colder weather approaching, that we try as best we can not to get too caught up in daily case counts. And what I mean by this is, let's not get too high when our numbers are low, and let's not get too low when our numbers go high, at least not until there's a pattern. It's easy to get overly excited and let our guard down when we have case counts in the low single digits. Conversely, it's easy to throw our hands up and believe our efforts don't matter when we see a few number of days higher than we'd like. Ultimately, I hope all Londoners look for larger trends, the 3, 5, and larger weekly averages. Not just case counts. Let's also pay mind to our active known case counts, our percent of positivity, hospitalization, and other metrics. Bottom line, certainly without speaking for Dr. Mackie, it's likely we'll see this yo-yo effect over the next several months, and I want Londoners to brace for that and just continue doing the good work we've been doing for so many months now, regardless of what a single day might indicate, positive or negative. And lastly, with the cold weather starting to set in, there's been renewed focus, and for good reason, on how we're looking out for and assisting London's most vulnerable. Unfortunately, there's also a perception among some that city officials are, quote, pushing homeless Londoners into riverbank encampments. I want to make it exceptionally clear, and in no uncertain terms, this is absolutely not true. We are not pushing homeless Londoners into the curbs or into riverbank encampments, nor are we encouraging homeless Londoners to avail themselves of those riverbank encampments. The fact anyone might be left with the impression that we're essentially trying to shoo vulnerable individuals away from public view, out of sight, out of mind, or push them into unsafe environments is not only false, it undermines a core personal value of mine and of the City Council. Not only that, but it insults the men and women on our staff who pour their all into helping our most vulnerable. People our staff visit 4 to 5 times a day, 7 days a week, people they know by name. I've told you what we're not doing, so let me tell you what we are doing. Since the onset of the pandemic, we have put up approximately 150 homeless individuals at various hotel and motel rooms. Thanks to additional supports from other levels of government, this will continue at least the spring. More than 24 of those individuals have been set up with permanent housing. We've also established comfort stations throughout the downtown. We provide close to 100 naloxone kits each month to individuals in hopes of preventing overdoses. And where there are encampments and when people refuse to seek shelter elsewhere, we work with individuals to ensure tents are properly spaced to reduce the likelihood of COVID. Before the pandemic, during the pandemic, and after the pandemic, our approach is not and will not change. It is one rooted in harm reduction and compassion. Sometimes that means supporting people where they are at. We cannot force individuals into housing, just as we cannot force them into shelters. When someone chooses to stay outside, our staff supports them wherever they are. Let me reiterate, no one at City of London believes sleeping along the banks of the river is a solution to housing, and nor does anyone on this council. Our multi-year budget, you'll remember, made investments in housing and social services to a level unlike any in recent memory. This isn't just lip service. This is an issue we take seriously, and it's one that continues to possess us. So in closing, let me thank the members of our coordinated informed response team and homeless prevention program. You are truly angels doing angels work. The same is true for our outside local agencies in this field. What you do makes a difference, and it truly matters, and thank you to them. Over to you, Warden Cathy, please.
Great, thank you very much for that, Mayor Holder. So we've been doing these briefings going on about 8 months now, and in the early days they were daily, and now of course they're twice a week, and I have the privilege to join you on a weekly basis. I took some time recently to go back and look at my messaging and that of Dr. Mackie's and the mayor's, and it has remained fairly consistent. Be physically distant, wash your hands, stay at home if you don't feel well, and mask up. Our community of Middlesex-London continues to amaze me, as everyone has worked so hard to be mindful of protocols and do their part to curb the spread of COVID. Now, sure, there have been spikes and lapses, but we are human, and that will happen. And I really appreciated actually what the mayor just said in not getting too high when the numbers are low and not getting too low when the numbers are high. I think that that is important messaging for us all to remember. I do hear from people across our region, and it is no secret that everyone seems to be getting tired. This way of living is stressful and demanding. What we have been asked to do takes effort. And I was reminded this week of the continued importance of this messaging beyond just curbing the spread. A friend of mine recently had surgery at one of our local hospitals, and I would like to share her observations with you. In her words, our hospital rooms are overcrowded. We all knew this. COVID continues to create some heartbreaking conditions for people to have to go through all alone, as visitors are very few and far between. Nurses are run off their feet, but still are kind and reassuring and brilliant. Everyone seems to be doing their best under often very difficult circumstances. It gave me a very clear glimpse into how precarious our situation is once again. If we let COVID get out of control, more people are going to have to be left alone in the hospital when they need their families most. More people will have to wait potentially life-threatening long periods for surgeries or care that they most desperately need. Our healthcare workers will face even more difficult work conditions and burn out, and some people who may have just won't make it. I just hope that we can all do our best for each other. Sometimes a little refresher course on how things are going in our hospitals is a good thing. Her observations really struck me. You know, when she first shared them with me, I thought this is something that I already knew. But her recent observations only confirmed our messaging. We are so focused on COVID that it is easy to forget there are many, many other health issues out there that need to continue to be addressed. We cannot go back to the place we were in the spring when everything was on hold. We cannot have those in hospital be left alone without an advocate or without support. By continuing to put the effort in and adhering to restrictions, respecting your bubble, the healthcare system can still work, and those requiring surgeries or procedures or treatments can still get those. If our healthcare system is shut down again, we will be in a far worse position than I think anyone can ever imagine. So you're going to hear me continue to say, be physically distant, wash your hands. If you are ill, mask up. On a lighter note, I just want to wish everybody a happy Halloween, and I want to remind everybody to practice safe trick-or-treating. To quote Dr. Mackie from an earlier meeting this week, you don't want to go trick-or-treating and come home with candy and COVID. Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. You know, from your analysis of the data to your really strong messaging, I feel my role in this daily briefing is almost obsolete at this point. So thank you very much for your contributions. We did have a very heavy day yesterday, racking up 16 cases over the day. Likely part of that is due to the batching that we know happens, particularly in the large provincial labs. The local labs flow the data through as quickly as they can. If you look at the long range average, we're still just under 7 cases per day on average over the last week or so. Sorry, just under 10 cases per day on average over the last week or so. So this one day, combined with the 2 low days before that, doesn't really change that picture. And at the provincial level, you've seen gradual climbing continue over the last few days as well. That 7-day moving average keeps creeping up at the provincial level. So we're happy to have been able to keep things relatively calm here and hoping that that can continue. Dan, I'll pause there and happy to share any questions.
Thank you, Dr. Mackie. Thank you, Madam Warden and Mr. Mayor. We do have quite a few questions, so let's get to them right away. Dr. Mackie, the first question is for you. It comes from Jennifer Beeman at the London Free Press. Dr. Mackie, what is behind the 16 case spike today? And I think you started to mention that just a minute ago. Does it have to do with lab reporting?
The cases reported today, yeah, some of them were batching. I mean, we did get, I think, 7 of those 16 just in the sort of the last hour at 8 p.m. of our case and contact management folks being in the office. But looking at the picture of where the cases came from in terms of exposures, it's pretty similar to what we've seen over the last couple of weeks. A number of cases from healthcare workers screening in long-term care, a number of cases linked with previously identified cases, occasional cases linked with, I think there was 1, perhaps 2 that were linked with school testing. We're picking up cases in schools simply because the schools have such tight policies around anyone with symptoms getting tested. So of course we're going to see those cases crop up in schools, and then a small handful of those 16 cases where we couldn't identify any previous exposures. The only real change over the last few days is that we have not seen a lot of cases linked with any of our post-secondary institutions. So that's a good sign on that side, especially as we move into reading week.
Thank you, Dr. Mackie. And a follow-up question from Jennifer. Dr. Mackie, what is the overall trend in London area daily case counts in recent weeks? And again, you addressed that a little bit in your opening remarks as well.
Yeah, it's fluctuated up and down a bit, but it's been relatively flat for 3 or 4 weeks, really since we hit that high around Thanksgiving. We did have, 3 of those 4 Thanksgiving weekend days come in around 20 cases per day. And then since then, we've been averaging around 10, a little bit less than 10 cases per day on the weekly average, sort of. So if you're looking at our 7-day rolling average, so that's been relatively flat here, even though it's continued to climb at the provincial level.
Thank you, Dr. Mackie. And we have another Free Press reporter with some questions, Heather Rivers. Dr. Mackie, many areas in the province have schools that have been hard hit by COVID. How do London area schools fare in comparison, and why?
Well, so, a lot of what's happening in schools is a reflection of what's happening in the general community. Our schools have excellent protocols, no doubt. That's the case for school boards across the province. But of course, where you have a lot of community spread, you're going to see a lot more cases in schools. For the most part, we're still not seeing a lot of spread within schools. There are occasional cases here and there where cases can be linked together, but you're not seeing the widespread, really devastating effects that COVID had in long-term care facilities. That simply isn't happening in schools, and that's in part because of the excellent protocols, and also likely in part because, students and healthy young folks in general are less efficient at spreading, particularly the younger age groups who are, more efficient at spreading many other illnesses like influenza, norovirus, etc. With coronavirus, that just doesn't seem to be the case. And again, lots and lots of really positive steps being taken by students, teachers, and staff in those schools as well.
Thank you, Dr. Mackie. Our next question comes from Elan Peterson at the Western Gazette. Dr. Mackie, is the Middlesex-London Health Unit expecting to see an increase in cases following Western's Reading Week? And for that matter, how might the health unit respond?
You know, if we look back at the past few examples of how this sort of event affected the spread, you know, I think of Thanksgiving, where we did see some cases that were linked to Thanksgiving activity, but not a tremendous number. I think back to Mother's Day back in May when we were closer to our peak, we didn't really see a bump around Mother's Day. I've seen some of the messaging from Western, for example, and to their students around, you know, safety precautions to take during Reading Week. I think those will be very helpful. Western students really took up the mantle of COVID after the outbreaks in September, and I know many Fanshawe students did as well. So I'm hopeful about Reading Week.
All right, and a follow-up question, Dr. Mackie, from Elan. Are there any more student cases associated with the outbreak at London Hall?
No, we haven't seen additional cases associated with London Hall. We should be able to declare that outbreak over the next few days.
Well, that is good news. All right, let's move on to the next question. Jacqueline LaBelle at Global News Radio, AM 980 CFPL, has a question for both Dr. Mackie and Mayor Holder. So, Mayor Holder, why don't we start with you in the response? We've been seeing some messaging online already, but could you both speak more about any concerns and recommendations you may have ahead of Reading Week? Mayor Holder, would you like to start?
Well, sure, and I would even imagine that the warden might have a comment on this as well. Look, one of the things that we have said, and we shared the same kind of messaging over the last number of events as it relates to post-secondary students. If you're able to stay in this community, stay in this community. I know it's a time when people typically go home to see their families and friends, and I get that. So if that's the case, you can take what the warden said at the very start of our messaging this afternoon about the things that you need to do. Watch your crowd sizes, wear your masks, and you know, I might add another: be careful of hanging out with strangers, which can be easy when you go to a different place. So it kind of goes back to that same point about knowing your social circles. Just cautions all around. So I won't repeat what the warden has said, but I think it's all good advice.
Well, and I think that's probably a great segue. Madam Warden, did you have a comment you'd like to add before we get to Dr. Mackie?
You know, I would just, you know, jump off what the mayor has said. I have university-age children, and this is a tough time for them. And having the ability to go home for a week, you know, is a decision they're going to have to make. And if they feel for their mental health they need to go home, I think we need to respect that. But they need to do it safely. And as we continue to say, if you go home, or if you're coming home, if other universities are having the same reading week as Western and you're coming back to our community, just watch where you go, be mindful of your hygiene, do all those things that you've been doing such a good job at, and you know, watch your crowd size, wash your hands, and let's just remember that people have to make their decisions as to how they're going to handle the next week for a number of reasons. As I say, mental health is a big thing, reconnecting with family, but just do it safely.
Thank you, Madam Warden. Dr. Mackie.
You know, the only thing I would add, I think those messages are all right on, is that the weather looks like it's going to be fantastic. I mean, aside from maybe some flurries on Monday, it looks like we'll have high highs and some sunshine. So, you know, anytime you can get outside instead of gathering indoors, that will really reduce your risk of spreading COVID. So think about those outdoor activities for the next week or so.
Well, thank you all. Let's move on to the next question. Jerry Dewan from CTV London has a question for Dr. Mackie. Programs are being rolled out to ensure people can get their flu shot. Western University has begun its flu shot program, and the Middlesex-London Paramedic Service is also starting the delivery of shots. But demand remains high. What would you say to people who are anxious about getting their flu shot?
Yeah, the flu shot's always an interesting one. In the years when we have shortage, demand goes up, and vice versa. We don't have a shortage this year. It's just that the supply comes out over weeks. It doesn't all come out right away. So that's where some of the supply pressures have been. But you don't have a shortage long term. So as long as you're calling around, checking beforehand, you should be able to get it from pharmacies in the area, or of course through your family doctor as well.
Thank you, Dr. Mackie. And I know, Madam Warden, the Middlesex-London Paramedic Service, that's something that I know you're involved in the rollout this week. I wondered if you would like to add a comment.
Yeah, if you don't mind, I'll take this opportunity to give a shout out to Paramedic Services. I actually got my flu shot through them today. And, I think it's a great program that they're able to partner with a number of community groups through Middlesex-London Paramedic Services and their community paramedicine program. They'll be able to get flu shots out to some of our vulnerable communities and to those people in our communities that may not have the access to be able to go to a pharmacy or family doctor. So I'm extremely proud of Paramedic Services and them rolling out this vaccine program this week. So just a shout out to them and that crew.
Thank you both very much for those answers. Mayor Holder, the next question is for you. It comes from Jane Sims at the London Free Press. Mayor Holder, about the homeless issue, not one landlord in the city took up the city's program to offer housing to the homeless. We know that there is a homeless encampment by the river, and this is an ongoing problem. Winter is coming. Is there anything that City Council can do to encourage landlords to get on board?
Well, Jane, hi there, and thanks for the question. I think that is certainly an issue that I think comes down to, frankly, individual communication with landlords. In my experience with this, the fact that there wasn't that take-up, that gives cause for concern. That doesn't mean it's not possible for that to occur. And I would tell you that landlords and developers and builders in a number of ways have helped provide supportive housing as they continue on with their developments. Because you make reference, and you do, to various encampments. That's never the preferred choice, certainly from our perspective. But too often for some folks who are homeless, that is their preferred choice. They get to circulate with people they know better. There aren't the restrictions around engaged housing, where they have certain requirements that aren't as flexible as when you're just out on your own. But the cold weather's coming, and we're exceptionally concerned about this. So I think what this will mean is there will be more individual communication from our staff at City Hall to ensure what we can do to open up some flexibility there. It was certainly a very generous offer that was made. We just need to have the uptake on the other side.
Thank you, Mr. Mayor. Dr. Mackie, follow-up question from Jane Sims for you. Dr. Mackie, it's been almost a week since the new modified orders went into effect for sports and recreation programs. Have any of the new cases come from recreation activities? Have affected organizations and businesses adapted to the new regulations?
Yeah, thanks for the question, Jane. I think what we can say confidently is that although some of the folks that have tested positive and been engaged in those programs, we haven't been able to demonstrate a link with any of those programs. So, sports and rec are not in this area causing a significant increase in COVID, and that's the way we hope and intend to keep it. We still are having ongoing discussions. Well, I should say we're still getting a lot of feedback, particularly from those in the yoga community. I guess there are some who believe that the lower risk style of yoga that's much more calming and lower aerobic in terms of its the style of yoga, shouldn't be subject to the same sort of restrictions as the spin classes, even though, some of the dynamics are similar. So that's one thing. As we revise the orders over the next, we've committed to revising them every 4 weeks if and when needed. We'll certainly look at that. There's a challenge from an enforcement perspective. As you can imagine, somebody who isn't necessarily a yoga practitioner can't necessarily walk into a studio and say definitively whether it's a high aerobic workout or a lower aerobic workout that's being practiced. But if we can find some way of making that definitive distinction, I think we could adjust that. We've also had questions around, who's responsible, operators or facilities or, the leagues or individuals. Really what we're expecting is that facilities and leagues will remind their participants of the rules and that, anytime that there is an egregious breach of the rules, that they would, assist us in providing that verbal reminder. We haven't had a lot of complaints at this point or needed to do a lot of enforcement around those new restrictions.
Thank you, Dr. Mackie. The next question is from Jerry Dewan at CTV London, and it's for you, Dr. Mackie. With the announcement of funding for more hospital beds, and I gather this is an announcement that came today that MPP Jeff Urick announced, it goes along with previous funding announced for critical care beds. Do you believe we're better positioned to ensure our healthcare isn't overwhelmed by COVID-19 spread?
Well, I would say we're well positioned. I think we were well positioned in the first wave as well. I mean, we didn't have overcapacity ICU or hospitals under the first wave of COVID. The difference now is that we're trying to keep up, the hospitals, I should say, not the health unit, the hospitals are trying to keep up as much as they can of those other really important services, surgeries, et cetera, that were all canceled during the first wave. So that presents obviously a challenge in terms of balancing resources. And so the new funding for additional beds is, will go a long way to make sure that those hospitals can maintain their services and also handle any COVID influx.
Thank you very much, Dr. Mackie. Thank you, Madam Warden and Mr. Mayor. That brings us to the end of our questions for this Thursday afternoon. We'd like to thank all of you for joining us for today's briefing, and to Mayor Holder and Warden Burghardt-Jesson and Dr. Mackie, thank you for your insights and for your information today. Always appreciated. We will see you again for our next virtual media briefing coming up on Monday afternoon at 2 o'clock. Have a great rest of the day and a great weekend as well. Take care.
And happy Halloween.